Welcome to the Justice Journal podcast. I'm Sacramento County District Attorney Anne Marie Schubert. I hope you enjoy this podcast series where we discuss important public safety issues and provide insight into who we are as an office and what we do both in the courtroom and in the community to provide the highest level of public safety through prosecution, prevention, and innovation.
In this episode, we'll continue our conversation on the Animal Cruelty Unit and Task Force with guests Prosecutor Hilary Bagley Franzoia, the City of Sacramento Chief Animal Control Officer Jace Huggins, and Veterinarian Dr. Sara Harrison, who are all members of the task force. Sounds like Sacramento has come a long way. What are challenges that you all still face, and what do you think would be the best resolutions?
I think that very everyday frequent things are ignored or just not noticed. I mean, just since starting the unit, I think that I'm looking around in parking lots more for dogs and cars than I ever have before. And I've been pretty focused on animals for a long time, but even now, even more so, because it's so prevalent. When you look at the numbers and you look at the occurrences, every time you drive into Walmart or Target, everyone should look around. I don't know about you folks, but I do. I've caught myself, I'm just constantly scoping the parking lots because it's so prevalent that, there could be a dog dying over there or something dying or a kid or whatever. I mean, just people are not using their mind. I mean, that is the most shocking part to me is and tying them up and in the backyard and getting up and leaving for the day, and it's 95 out and the dog is stuck on a chain and has no water. It's bad enough you haven't fed it for a while, but now it has no water and it's hot and they die in your backyard. So we get a lot of those. I mean, just things that people can avoid or prevent. You look over your fence and see why that dog's been quiet. That's the dog that you complained about barking too much 2 weeks ago. I mean, it's just use your mind.
For me, one of the focuses I have right now are working with veterinary hospitals and helping educate them on the duty to report, but also when and what to really be looking out for, how to set up processes for them to make them not feel like they are selling out their clientele, if you will, but also making sure they're getting information reported into us when it's necessary, because I think that is also very, very helpful for us.
Would the veterinarians call
311?
Mm-hmm. Yeah. I just called Jace.
Well, and if you think an animal is being abused and it's crying, you should call 911. I mean, I don't hesitate to tell people that.
If an animal
it's a crime.
Yes.
The crime's occurring.
Right.
It's right now.
Right.
It's dying next door or it's being beaten. Call 911 and tell them it's going on right now and the guy is apprehendable right now. I mean, don't shy away and think you're going to get in trouble for calling 911 instead of 311. I'd pick up and I'd call 911. Mm-hmm.
One of the things that we're trying to do at the city is start a door-to-door program where we go into our neighborhoods that we know have the lowest resource ability and actually door-to-door educate, teach people, provide them with information, how to follow the law. We're actually looking at getting donations of fence boards and fence repair material, all that kind of stuff to try and help. For me, it's a community engagement thing. It's helping our community become better pet parents. But on the flip side of that, if perchance we end up at one of those houses for a cruelty case, I know that being able to provide Hilary with the sheet saying, we were out there 5 months ago and we provided all of these resources and we did all of these things for them, yet they still chose to do this. And that's one of the things that I really talk to my officers about. Our goal is never to criminalize lack of finances, lack of resources. That is not what we want to do. However, if someone proves to us that they are making choices that allow that animal to suffer despite having been given other options, that's when we have a problem. So when we talk about the veterinarians, someone comes in with a dog with, broken shoulder and is in a lot of pain, and the owner says, I don't have enough money, I'm going to find another vet. And so they go, and then they don't find another vet. And then we go out there and say, hey, have you found another veterinarian? Well, no, I just don't have the money for it. They made the choice to not make any other attempts to get that animal care. However, if somebody's like, I have an appointment here, this vet gave me these pain pills, that's a different situation. So a lot of times for us and our officers, we're looking for active involvement of the owner, trying to prevent or stop that animal from suffering. So when we talk about the community engagement aspect, I think that actually will help the task force in the long run, because it will help us build even better cases if we need to. Hopefully we won't by providing that information, but if we need to, it would be helpful.
It's not going to stop with just education. I mean, that certainly will take care of a lot of it, but people tend to be lazy. They want something, but they don't want to be responsible for it. And it's not that important to them. And as a result, that living thing that they felt they needed to have suffers. It's as simple as that. They chose whatever they were doing, their own selfish reason for not doing it. And it's that apathy that there almost has to be really a stigma on that mindset, that apathetic mindset, that it's not that important. I talked to someone who was a professional not that long ago. And he told me that he was going to get a new German Shepherd puppy. And I asked him about the neutering because I knew it would be a male. And there was no amount of education that was going to change his mind. In his mind, he told me, he says, I'm not going to neuter a male dog. I wouldn't do anything to my dog that I wouldn't want done to me. That was the mindset. Now, what education is not reaching that person? Well, quite honestly, if that's his mindset, I don't know that the education would change his mind. I think that when it comes to spay and neuter, the public thinks, okay, yeah, spay and neuter is good to keep the numbers down. But what they're losing is spay and neuter is good for the animal. Okay.
Oh, health-wise?
Health-wise, it's better for the animal. And Dr. Harrison can certainly talk to about that, I'm sure. But that's a level of education that's not reaching the masses. I don't know if it'll make a difference. I think it would for some folks. But that mindset of that, I don't know, it's kind of a macho mindset. He had the money to do it. He's probably not interested in breeding the dog, but he just refused to take responsibility. And so that dog will jump over a fence to get to a female dog, and it'll be running in the streets, and it'll be hit by a car. And there it is, right there. A bad death. That's the ultimate, for me, the end point, the bad death. We see it every day. Obviously, I have to compartmentalize it, but it never gets easier.
Yeah. Can you speak to the health aspect of?
Yeah, I mean, it's been a while since I pulled the papers, but on a statistical basis, altered animals live on average about 2 years longer than unaltered animals. And that's due to a combination of factors. They're less likely to roam, which means they're less likely to get hit by cars. Depending on where you live, they're less likely to get shot, because it is legal to shoot dogs on your property if they're harassing your livestock, or you at least say they are. They're less likely to get certain types of cancer. They're less likely to get pyometra, which is an infection in the uterus. Obviously, they won't get one if they don't have one. And then obviously they're less likely to have dystocia, so difficult pregnancies. They're spayed, they're not going to get pregnant. And we have, a fair number of people, if you aren't able to afford or pursue spaying, you're probably not going to be able to afford pursuing a $2,000 emergency C-section. In the middle of the night. And so, there's a lot of protective benefits of it. There's been some recent studies out of Davis that are kind of a little bit limited in their scope, but, challenging to interpret how to, give advice to the population as a whole. There may be some slight protective benefits of waiting in some species, delaying it until they're a year or a year and a half, but it's a pretty limited study and a very narrow scope. And so my recommendations still are to spay and neuter before sexual maturity. And also the biggest issue as a population goes is we need to stop having litters of animals. I see in practice all the time, people are like, oh, we just want them to have one litter, or it's not just one litter. It's very rarely do they just have one, but it's like all of those, you know, and it's exponential, because then, you know, out of that litter, well, maybe, you know, only half of them get fixed, and then you continue to have litters. And there simply just aren't enough homes. A lot of our problems with animal cruelty and funding and everything could really be solved if we had a lot more of a responsible approach to pet ownership, which includes spaying and neutering. It's really huge. And also microchipping your animals, like people, like microchip your animals, because a lot of animals come into the shelter, like, you know, we may or may not have good owners who want them back, that they're not identified, you know, tags fall off, collars fall off, and, you know, microchips the best way to, you know, reunite things. You know, with their owners. So,
yeah. And I would say, you know, we talked about education a little bit. The other thing I talk to people about a lot is pet insurance. Finding a way, if you can work pet insurance into your monthly. Yep, it's health insurance for your animal. It's not as good as human health insurance across the board, depending on the different companies, but there are certain ones, if you kind of research it, that will cover yearly vaccines, yearly dentals, all of the things that we tell people your animal should be getting. There are health insurance plans out there for pets, and you pay a monthly fee. And I can tell you from experience, it's a lot easier to pay a monthly fee that you kind of forget about than get hit with a $9,000 bill, which is what happened with me with my Doberman Pinscher. Yeah. So she got really sick, and we maxed out credit cards, and we've had health insurance ever since. But, you know, it really can make a difference.
Yeah. So vaccination really is, with one exception, is individualized to the animal, or should be. That exception is rabies. Rabies vaccine is mandated by law, and so they have to have it. That is no ifs, ands, or buts. And titers are not. You can't substitute titers for vaccination. And so that being aside, there are a number of other vaccinations, and yes, and some people's animals are more, you know, inside than outdoors. Some don't go to dog parks, some don't go camping and hiking. And so there are some vaccines that we would maybe elect not to do in those cases. Like if your animal's never going to go out in the woods and just stays at home and is kind of a house dog, you may or may not need the lepto vaccination. However, if your dog is going outdoors, even if it's in your backyard to go to the bathroom, in this area, lepto is spread by like possums, rodents, all sorts of things. You live in Sacramento, those things are in your backyard. You know, we talk about things like the distemper parvo vaccine. We don't have a lot of distemper in California anymore because the vaccination program has been so successful. But you also have, you know, part of that vaccination is parvo. Parvo is a virus that's incredibly hardy and can live in the soil for a year or longer. And that includes in your backyard, and in other areas too. You know, so while vaccination should be individualized based on the pet and its exposure risks, you know, it's very, you know, unless your animal's living like in a little bubble inside your home, it's still potentially being exposed to things. Now, vaccination itself is relatively inexpensive, and I'm sure Jace will talk in just a minute about some even free opportunities. You know, the diseases that these vaccines prevent are not only very concerning and deadly in many cases, are really expensive to treat. They're really expensive to diagnose, and ultimately, like, they're really horrible diseases to have if you're a dog. And so there's a lot of, you know, with the anti-vax movement, that's in the people side, it's coming over to the animal side. No, there's never been a reported case of autism in dogs, as far as we know, especially not from vaccines. So it's, you know, I mean, I understand people's sometimes reluctance to, like, they want to do as less as possible. But honestly, if I had to choose between giving my animal like a vaccine and like paying to treat it for parvo, I mean, you know, and then a number of things that have to be given to your animal in order to like potentially get it to recover from that disease, you know, vaccination is obviously it's a clear winner for me. And
yeah. As far as clinics, most of the local jurisdictions have laws on their book that require that shelter to provide a low-cost vaccine clinic at least once a month. City of Sacramento is, I believe, on a Wednesday night, and anyone can call 311 and ask county or city, hey, where's the next vaccine clinic? I think we typically do 2, and then we also have the VIP pet clinic comes to our shelter too on occasion. VIP also goes out to Western Feed, which is up towards the East Sacramento area, and they do vaccine clinics out there also. So Dr. Harrison touched on, distemper, parvo, stuff like that. As far as the rabies go, it is mandated by law. We have very few cases of rabies ever in the California region because of that law and because of all of those vaccines. But the other aspect to the rabies vaccine, because we hear it a lot, my dog never goes outside. Why does it need a rabies vaccine? So by law, if an animal bites somebody, there's a quarantine period that has to be adhered to. If your dog is vaccinated, let's say you had a friend come over and your dog got a little protective and nipped your friend. If your dog is already vaccinated, my officers and I are going to be far more likely to allow you to do that quarantine at home than if your dog is not vaccinated. Because if your dog is not vaccinated, there is a much higher percentage that there is a possibility that animal could be rabid. And therefore, we're going to be more likely to mandate that the quarantine be either at a veterinarian at your expense, enjoy that bill, or at the shelter at your expense. So home quarantine is within the realm of our purview to be able to do, but we look at things like, has this animal ever had a rabies vaccine before? And it plays into our final decision. Mm-hmm. So that's just kind of, something to think about that people don't really realize. It can be as simple as a friend coming over. So,
or, biting a vet.
Biting a vet.
It's, even though it's part of our job. If your animal bites somebody in a vet clinic or at a groomer or in one of these places where animals are, maybe dogs being made to do things that it doesn't really necessarily want to do. Even nice dogs in this situation, they only have a couple ways to defend themselves. Yeah. And an accidental bite, I didn't really mean it. It doesn't make a difference as far as quarantines and stuff goes.
Is the owner responsible for what happens to the person who was bit?
Yes, that goes into a whole other realm of the law of dangerous and vicious animals and stuff like that. But yes, in the civil-minded way for medical stuff, yes. And then there's also the potential of an animal being declared. And, I want to actually put some numbers down for people to think about. Generally, if you go to like a VIP clinic, your distemper parvo vaccine is going to cost you in the realm of $15 to $20. An appointment and a parvo test is probably going to cost you $150 to $200
on a non-emergency.
On a non-emergency basis. Wow. So I really I tell people those numbers all the time, like literally $15. Bring up $15 right now, and this is what you could save yourself in the long run.
And you talked about your guys' the city clinics. I know the county has a mobile unit that goes around once a month.
Batmobile.
The Batmobile. I think it stands for Bradshaw Animal Assistance Team.
Yeah.
And they go out to different locations in the community at least once a month, and everything's free. It's for low income homes. I think the cutoff's all the information, I think it's like 48,000 or something, income. But they do rabies vaccines, distemper, kennel cough vaccines, microchipping, deworming, flea medication, collars engraved with tags. They'll give you a spay and neuter voucher, and it's all free. And so there are all these resources that are available. And so, whenever I hear from somebody like, I didn't do this because of the funds, I'm like, there are all these free things and all these opportunities that are available. Like, I want you to do what's best for your animal and what's best for you. It may take a little bit of legwork. You might have to give up, a Sunday morning to go down to one of these things, but ultimately it's going to pay off in the long run. And that's a huge thing that, the county does. And I know other organizations do as well.
Is there anything else that we haven't covered that you want to bring up before we close?
Where do we feel the public should be right now? How could the public help us do this more efficiently?
Well, we haven't talked about it, but I've been thinking that we maybe should. 'Cause when it started, we had that big call from all these volunteers who all wanted to help, and we're like, well, we don't know quite what to do with them.
Yeah.
We have all these private groups that on the individual, like we have the Friends of Front Street, which helps with the city of Sacramento shelter and help with absorbing some of the costs of some of these investigations.
Mm-hmm.
You've got the team over at Bradshaw, which kind of helps there too. It might be nice if at some point we could get together some volunteers and create our own kind of
I was actually just thinking
private,
about that last
like
night.
our own, that was, specifically for the prosecution and investigation of animal-based crimes,
Mhm.
and that could help support more directly. So we aren't taking resources from the shelter. I mean, they've been everybody's been really great,
Right.
and they really want to help, and I think that's great. But that's not an unending. It's not an unending supply there, right?
And you can do more with more people.
Yeah, and we could do more with more people, and there's obviously a big, this is something that people really care about, and so I think that might be. That's not something that I could ever organize, but I would like,
Yeah.
right?
Limited time we have.
Well,
But I mean, if we had volunteers,
Get a volunteer to organize the
volunteers who were, had some experience in starting and running nonprofits, and doing fundraising and doing outreach and things like that. I could see that being helpful. I don't know what the legal ramifications are
it
of
would
that,
be,
but
that would be, because if it was task force related, it would be through the Sac County.
Yeah,
but,
we would have.
but sometimes you kind of get tunnel vision. You're doing all the things you're doing. And I actually saw a Facebook post from a animal control department in Texas, and literally their officers did a walk and they got donations for their walk. And they ended up raising almost $10,000 to go directly towards their animal cruelty cases, So, that kind of stuff, just like what Dr. Harrison was talking, I think that's kind of our next step for continuing to develop, because our shelters, SAC SPCA, Bradshaw, Front Street, they also have a job and we are part of that job. But I do think it would be really great if we can start streamlining funding, that goes directly towards the concept of animal cruelty investigations. Like, I'm probably going to have to go ask for donations for body cams for the animal control officers. We're not part of PD. We don't wear them. Animal control officers, because they're held under a different law, they can't do all of the same things that police officers can do. And so for me, body cameras, it's good for the safety of the officer. It's good for being able to follow up on stuff, but also it's a way for us to capture all of our initial evidence right away, everything that everybody says to us, which I think is even more important for animal control because we don't have those months and years of training. There are things that sometimes newer officers come back and they're like, and they said this, and I'm like, did we do this? And they're like, no, didn't even think about it. So for me, body cameras are a big thing. And again, something else that not in any standard government budget right now for animal control.
I think a walk would be great because it'll help raise funds, but it also gets awareness out there.
It's another thing that's sometimes hard because people have this concept of how an animal should be treated, and the law definitely doesn't match that. My saying across the board is, if there was a law that said you had to love your dog, I would enforce it. However, there is not. There's a law that says you have to provide food, shelter, water. Hillary's like, I can write that law. I see her over there.
How would I word that?
Right. But, it is important because the more information we can get out to help people understand what these crimes are and what we need. You had said, what can the public do? One of the things that's hardest for us is anonymous callers. We completely understand why you want to be anonymous, but if I can't call you to follow up and get more information, I probably can't do anything. So kind of this, when we see this injustice and we have that feeling inside of ourselves, we all have to take that moment to stand up and say, this is what's right and this is what's best for the animal, and try as hard as possible not to be scared. Know that we will never throw you under the bus when we're out there doing an investigation. So I think that's really important for me to make people understand that. Let me know who you are so I can at least call you,
Yeah, with an anonymous call, the very most you're going to be able to do would be to take the animal out of that situation, maybe on a good day.
Yeah.
But as far as a prosecution, that you're going to have to develop it from that point on. And anything you see when you're there,
Yeah.
And I don't think that should be enough, just taking that animal out of that situation, because that person either is going to come down to the shelter and fight to get that one animal back, or they're going to get another animal, which is very easy to do. And the cycle is just going to continue of the abuse and the neglect and endangerment or whatever the issue is. And that's the problem. And with a prosecution, of course, the penal code allows, by operation of law, that if a person is convicted of a felony, they are prohibited from owning or residing anywhere near an animal for 10 years and 5 years on a misdemeanor. So that's very important. And that's another reason why we want to pursue these cases. I wish the public would take so much of the energy, emotion, devotion, and call their legislators and demand change in the law. There are so many changes we could make. Most of these laws were written in 1905. They're hard to read. Case law has interpreted them certain ways and added certain elements. It's just a cluster. And if people would show to the people that make the law that they want changes and they want them to pay attention and that this is important, those changes will be had. But it's going to take a lot of lobbying and a lot of calls.
What about the ASPCA? Are they involved in laws and that kind of thing?
So the ASPCA is an organization based in New York. They're not a law. They do law enforcement. I think they can do law enforcement in New York. They go and they help.
But don't they lobby?
They do lobbying. So they are, so when people see all those commercials for the ASPCA, like that's what you're paying for. Yes, you're paying for them to develop training for forensics, because that's what paid for the development of the program that I went through was the ASPCA. But they're also doing lobbying. So like they're a very important organization. But they are also not coming over to Sacramento and like helping us do our job at all.
Yeah.
They're a big organization, but again, like they're pretty limited, and they're not affiliated at all with like local SPCAs.
Yeah,
they're completely separate.
Yeah.
And for sure, ASPCA has nothing to do with SPCA, because I know that they're in the next podcast that we do. Certainly not.
Yeah.
There's a big confusion there.
Yeah. The other thing too is that there may be one organization out there that is dedicated solely towards animal control and humane officers who are the ones dealing with this body of work. So when you look at ASPCA, HSUS, Best Friends, Maddie's Fund, UC Davis Corrette, those are all shelter stuff. And then, animal control and law enforcement is a portion of it, but it is not their direct focus. There is NACA, the National Animal Control Association. However, they are a very small group. There's not a lot of donation. Mostly it focuses on training. So there's really not anything out there right now that is, unless I'm missing something, honing in really on animal cruelty investigation, animal control, humane law enforcement and stuff.
I mean, the Animal Defense League does some of that. But again, they are limited again, right? I mean, they have the same thing, and they do provide funding, and they will help with legislation and lobbying and things like that. But like, it has to start here first.
Yeah.
They can get some support. I mean, California has, by the ALDF's rankings, it's like number 8th in the nation as far as our legal protections for animal cruelty. And like, honestly, I feel like we should be number 1. It's California. Don't get me wrong, 8's not bad. And compared to other states, like we're doing pretty well. But there's some big holes missing in our legislation. And it takes the public coming forward. Like a couple years ago, there was legislation going through to try and get bestiality a felony in California, because it's a misdemeanor. And
just a wobbler. So we'd have the option of one way or
exactly.
the other.
Like maybe
couldn't pass it,
and they couldn't pass it through the legislation. Governor wouldn't sign it. And like, that's California. It doesn't have. You can only get a misdemeanor for bestiality.
That's
I think Nevada, you can get a felony for it.
Yeah.
And like, that's Nevada, where you can do pretty much anything you want.
Yeah.
And
it's crazy.
And it's just, it's kind of mind boggling when you think about it. Now, part of the problem is that, that probably that didn't get a lot of play in the media, and I don't think a lot of people, there wasn't a big call or a push, for public support and public outcry. Like, and when it didn't go, it was like a little blurb, and people were like, "What? That's weird." And then it just kind of died from there.
Yeah.
And it's like,
We talk about that in the next podcast where people knew there would be public fury about that.
And I mean, anytime you talk about legislation, like we have the section here about mandating training. So for an animal control officer, there hasn't been mandated training. There's legislation right now trying to get mandated training. And I believe it was originally started at 2 weeks or 1 or 2 weeks that they wanted mandated training that an animal control officer had to go through. And because there is such a disparity between animal control, humane officer departments, there was pushback because some departments were like, I can't afford that. I have one animal control officer. We don't have a budget that can pay for mandated training. Anytime you have legislature and something's mandated, you have to figure out where's the money coming from, right? And so the state was like, well, we're not going to pay for it. So I believe what it ended up at was 16 hours is what they're trying to push through right now, 16 or 24 hours. So it's so much bigger, it's not because animal control departments don't want to do it. There's a lot that goes into it. Right. But anytime you look at legislation, you have to figure out who's going to push back, who are we going to affect by maybe unintended consequences, and also where's that money going to come from when something like mandated training becomes a law.
Mm-hmm. I think we had a very in-depth conversation. We're going to continue this in our next couple episodes. So I thank you all very much for helping to get this conversation started and for the dedication that you clearly all have for the work that you do.
Thank you.
So thank you.
Thank you.
Join us for our next episode where we'll have a second discussion on the Animal Cruelty Unit and Regional Task Force with returning guest Prosecutor Hilary Bagley Franzoia and new guests Sacramento SPCA CEO Ken Altine and veterinarian Dr. Cheryl Scott, who are all members of the Regional Task Force.
Thank you for listening, and I hope you enjoyed this episode. You can find all of the Justice Journal podcasts on our website at sacda.org, iTunes, Google Play, and YouTube.